The intensive care unit is a realm of contradictions. It's a place of both vulnerability and resilience, where the human body, pushed to its limits, relies on advanced medical technology and skilled practitioners to recover. Within this delicate balance, pharmacotherapy plays a crucial role. Medications become tools, wielded with precision to combat disease, manage symptoms, and ultimately, offer patients a fighting chance. Imagine a patient arriving at the ICU, their breath shallow, their pulse racing. This is not the time for indecision. Every second counts. This is where the art and science of pharmacotherapy converge. It's about knowing which medication, at what dose, and at what precise moment can alter the course of a life hanging by a thread. The decisions made in these critical hours can have lasting consequences. A timely dose of antibiotics can mean the difference between recovery and prolonged illness. A carefully titrated sedative can provide comfort and reduce anxiety in a patient overwhelmed by their condition. Pharmacotherapy in the ICU is not merely about administering drugs, it's about understanding the intricacies of human physiology and the nuanced ways in which medication can restore balance and promote healing. The collaboration between doctors, nurses, and pharmacists is essential. Each professional brings their expertise to the table, ensuring that every decision is well-informed and every action is precise. In the end, it's this teamwork and dedication that can turn the tide in the battle for a patient's life, making pharmacotherapy in the ICU a true testament to the power of modern medicine. Sepsis, a life-threatening condition arising from the body's extreme response to infection, requires swift and decisive action. Early recognition is paramount, as delays can lead to severe complications and even death. The telltale signs, fever, rapid heart rate, low blood pressure, are not mere symptoms to be treated, they are alarm bells, signaling a system in distress. Recognizing these signs early can make a significant difference in patient outcomes. Empiric antibiotics, broad-spectrum agents designed to target a wide range of potential pathogens, are often the first line of defense. Administering these antibiotics quickly can be life-saving. These powerful drugs buy precious time, halting the spread of infection while further investigations, such as blood cultures, are carried out to identify the specific culprit. This dual approach ensures that treatment is both immediate and targeted, but antibiotics alone are often not enough. Comprehensive care involves multiple strategies to stabilize the patient. Vasopressors, medications that constrict blood vessels and raise blood pressure, play a critical role in stabilizing the circulatory system. They are essential in managing the severe hypotension that often accompanies sepsis. Sepsis can lead to a dangerous drop in blood pressure, depriving vital organs of oxygen. This can result in organ failure if not promptly addressed. Vasopressors, carefully titrated to achieve the desired effect, help maintain blood flow and support organ function. Their use must be closely monitored to avoid complications. The management of sepsis is a race against time, a battle fought on multiple fronts. Every second counts, and a coordinated multidisciplinary approach is essential for improving survival rates. A delicate balance ventilation and support in ARDS treatment.